Let me tell you about a time that I watched a real exorcism. So I got a call from a friend recently who was worried about a family member who was in a mental health crisis and had severe depression. It brought me back to my 20s when someone really close to me, their mother, was suffering from severe depression. She was barely eating, she would stay in bed all day, and eventually locked herself in the basement. The family was deeply religious, so they called a pastor to pray over her. And when the pastor arrived, he was praying over her and shouting to cast out the demons of depression and that God's power restore her. But here's the thing. Depression is not a demon, and it's not something that someone can simply shake off or pray away. Depression is a real medical illness with complex biological, psychological, and social causes. Inside the brain, the wiring and the chemical balance get disrupted. So neurotransmitters like serotonin, norepinephrine, and dopamine don't work properly. Stress hormones like cortisol stay too high, and that damages circuits that regulate mood and memory. Neuroplasticity and growth factors like BDNF drop, making it harder for the brain to adapt and heal. Genetics and trauma play a big role as well. This is why you're at higher risk of developing depression or mental illness if it runs in your family, and why life stressors can activate vulnerable genes that lead to depression. This is what we refer to as epigenetics. And this is why treatment of depression isn't a one-size-fits-all. If the symptoms are mild and your loved one is motivated to get better, a combination of therapy and lifestyle changes like sleep, exercise, and avoiding alcohol and drugs, and sometimes even medications, can be very effective at treating depression. But if there are red flags like suicidal thoughts or plans, refusal of help or loss of insight, severe decline without treatment, or they're unable to care for their basic needs, these are clear signs that this is a true medical emergency and that a trip to the ER is warranted. So if your loved one is willing, bring them to the ER. If they're unwilling and clearly unsafe, it would be appropriate to call 911 or the non-emergency line to request for a wellness check. In that story I told you, prayer alone didn't work. She got worse, and eventually we took her to the ER where she was admitted and started on medications and psychotherapy. It wasn't an overnight fix, but with the right help, she did get back on track. The bottom line is that depression is real, it's serious, and it's treatable. But sometimes urgent action is needed to keep someone safe.